In the last couple of videos, I've been talking about chronic pain, the nervous system, and how symptoms don't always fit neatly into traditional medical explanations focused on disease, injury, or tissue damage. In this video, I want to talk about something that sits alongside all of that, something that can have a huge impact on people's experience of illness, and that's communication with healthcare professionals. Because for many people, one of the most difficult parts of living with chronic illness or difficult ongoing symptoms is not just symptoms themselves. It's the experience of trying to get help. So you might recognize some of this. Appointments that feel rushed, feeling like you're not quite being heard, trying to explain something complex in a very short space of time, or leaving a consultation with more questions than answers. And sometimes it goes beyond all that. At best, appointments may feel hurried or incomplete, and at worst, people can leave feeling dismissed, misunderstood, or even blamed for what they're experiencing. They may hear things like, all your tests are normal, we can't find anything wrong, it's probably just stress or anxiety. Or they may come away with the feeling that their concerns weren't taken seriously at all. And some people even describe feeling as though they're wasting the clinician's time simply for seeking help. Because as far as the doctor is concerned, there's nothing wrong. And when you're already struggling with difficult symptoms or feeling extremely unwell, that can be incredibly upsetting and frustrating. But for many people, it goes even deeper than frustration. Imagine feeling genuinely ill, perhaps struggling to work, care for your family, sleep properly, or simply get through the day, and then leaving the appointment or appointment after appointment without answers, without a treatment plan, or without any real sense of what happens next. That can create a profound sense of helplessness and hopelessness. And people often describe feeling abandoned by the very system they turn to for help. And when you're suffering and you don't know why or what can be done about it, the absence of help can sometimes feel almost as distressing as the symptoms themselves. Now, it would be easy to frame this as doctors not listening or patients not explaining things clearly enough. But the reality is usually much more complicated than that. So, for starters, modern healthcare systems are under enormous pressure, and appointments are often very short. There's also a strong focus on diagnosis and treatment within a very restricted time frame. And much of medical training is still geared towards identifying very clear, discrete diseases. That approach works very well in many situations, but when symptoms are complex, persistent, or they fluctuate over time, or don't fit neatly into one category, it becomes much harder to navigate within that model. And this is where communication can start to break down. So, from the clinician's side, there may be uncertainty about what's going on, pressure to reach a conclusion quickly, or limited tools for addressing symptoms that may not have a straightforward explanation. And that's particularly true when it comes to conditions involving the nervous system, symptom perception, central sensitization, or other neuroplastic processes that we talked about in the previous two videos. Many healthcare professionals also receive relatively little training in these areas. So even when a clinician genuinely believes that symptoms are real, they may not feel confident explaining what's happening or know how best to discuss it with a patient. In fact, they may not fully understand it themselves. Now, from the patient's side, there may already be frustration, anxiety, fear, or exhaustion, and a desperation to get better, especially if symptoms have been ongoing for a long time. There may have been years of appointments, tests, referrals, and uncertainty, and trying to communicate all that clearly and calmly in a 10 to 15-minute appointment can feel almost impossible, quite frankly. By that point, many people are carrying not only the burden of their symptoms, but also disappointments of previous consultations. Every new appointment carries a mixture of hope and dread. Hope that maybe this time someone might finally understand what's happening, and dread that they will leave feeling exactly as lost as before. So, what can happen is that both people leave the interaction feeling dissatisfied. The clinician may feel they haven't been able to provide a clear answer, and the patient may feel unheard, dismissed, or not fully understood. And I do want to name something here because it's important. For some people, these experiences go beyond feeling rushed or unheard. They can feel dismissive in a way that's deeply unsettling. Sometimes people are told directly or indirectly that literally nothing is wrong in a way that doesn't feel like an explanation, but like a complete dismissal. And when that happens repeatedly, it can start to feel like your experience is being questioned or even minimized or completely invalidated, quite frankly. And we often describe that as medical gaslighting. Now, I'm not using that term to assign blame to individual clinicians, but it is something that many patients genuinely experience, and it can have a profound impact on trust, safety, and a willingness to seek help. So over time, it can affect much more than individual appointments. It can actually shape how safe someone feels seeking healthcare at all. So for some people, it can also create a deep sense of isolation. If healthcare professionals can't explain what's happening, family members may start to question it, employers may question it, and sometimes patients begin to question themselves. They know something is wrong, yet they may feel increasingly alone in trying to make sense of it. For some people, repeated difficult experiences in healthcare can lead to significant healthcare related anxiety or distress, where just the thought of making an appointment, or even sitting in the waiting room, or talking to a doctor can trigger anxiety, apprehension, dread, or even trauma. And that matters because feeling unheard, understood, and taken seriously is not just a nice little extra in healthcare. It's a fundamental part of good care. And when people are frightened, exhausted, in pain, or struggling with unexplained symptoms, they're often looking not only for a diagnosis or treatment, but also for reassurance that their experience is real, that it matters, and that they won't be left to face it entirely on their own. It affects how safe the nervous system feels. It affects how information is processed. It affects trust, and it can even influence how symptoms are experienced over time. Now, I also want to make an important distinction here. Healthcare systems may be under immense pressure, time may be limited, resources may be stretched, but showing respect, curiosity, compassion, and preserving someone's dignity does not necessarily require a longer appointment. Sometimes it's as simple as acknowledging uncertainty in an honest manner, saying, I can see this is having a real impact on your life, or making it clear that a normal test result does not necessarily mean there isn't anything wrong. Those moments can take seconds, but they can make an enormous difference to how a person feels leaving the consultation. So communication isn't a small issue. It's actually a central part of care. Now, this doesn't mean the individual clinicians don't care, but it does mean that something important can get lost, especially for people with chronic, complex, or poorly understood conditions. And it's also worth saying that good collaborative care does exist, of course. There are many healthcare professionals who are excellent communicators, who do listen carefully, who acknowledge uncertainty when it's there, and who do work alongside patients rather than talking at them. And when that kind of communication is present, it can make an extraordinary difference. So part of what I want to do on this channel is to bring more awareness to that gap, to help patients, clinicians, and families better understand what's happening and how it might be approached differently. Because when communication improves, everything else becomes easier to navigate. Now, in the next video, I'm going to talk more about the broader experience of chronic illness and why it's about so much more than physical symptoms alone. But for now, if you found this video helpful, please hit the like button, subscribe, and do share it with anyone you think might benefit. And hopefully I will see you in the next video. Thanks for watching.